Scott County, providing safe, healthy, and livable communities.
Suzanne.
So good morning. My name is Suzanne Arnson. I'm the Child Welfare Manager here.
I'm Chris Harder. I supervise one of the child protection units.
Julie Swanson. I'm another supervisor in child protection.
Beth Mahoney, another one of the Child Protection Supervisors.
Oh, Lori Huss, Employee Relations, panel member.
Brad Davis, Planning Manager.
Lisa Koner, Public Affairs, panel member.
Leslie Vermillion, the Deputy County Administrator, panel member.
Indulge me, I just picked up my pen. First is
Suzanne Arnson.
Chris.
Chris,
Julie.
Julie, and Beth. All right, thanks.
All right, well, I'm just going to start us off to provide a little context about the Child Protection team. Obviously, we have 3 supervisors that supervise the entire Child Protection team, and I think what makes Scott County unique is that while each of the supervisors has designated staff, really they share joint leadership for the Child Protection team. So starting from intake and assessment, we have 3 Child Protection staff who field calls from community people expressing concerns about children, and then we screen those calls to determine if the child maltreatment report, meets specific state criteria for an assessment. And if it does, it's assigned to one of 14 child protection workers. And if there's a need then for ongoing child protective services, the worker generally who does the assessment will also provide the ongoing work with the family. So that's sort of the child protection. In addition to the child protection workers, we have 3 social worker ones who provide case support, predominantly around supervised visitation for children in foster care so that they can maintain and have frequent contact with their parents. So that's sort of the staffing structure. In terms of certainly current events within child protection, I think many people know back in 2014, the governor's task force around child protection was initiated as a result of several child tragedies. That work around systemic change and reform really continues today with a legislative task force on child protection that continues to provide oversight and certainly recommendations around continued system change. That change has really impacted the need for child protective services intervention here in Scott County. So in 2015, as a result of the governor's task force, new funding was allocated to support increased staffing, which we did. But despite even that increase in staffing, the demand continues to grow at a pretty fast pace. That has really resulted, I think, in our leadership team talking more about how do we continue to support our workforce and look at the well-being of our workforce to sustain that, because we know strong, stable staffing supports and promotes good outcomes for kids and families. So despite all of the fast-paced nature of the work and the change that's happening, I think the thing that I want to stress is that Scott County has and continues to be a leader within this child welfare system across the state. As we'll talk about the data, you'll see a number of performance areas where we are certainly exceeding state and or federal performance standards. And I think the performance is really supported by 3 things. And that is 1, strong workforce, strong, stable workforce, that we've had very low turnover. Although I will say we've had 2 recent resignations, so that's an area that we need to watch and consider as we move forward. Second is really around our signs of safety practice model. That is around engaging children, parents, and their networks to assist us in really evaluating, monitoring, and assuring child safety. I think that is an inclusive process which really helps create increased transparency between the agency and the families that we're working with. That time intensity, again, often falls to staff, and so to meet the need to engage with families, and the strong commitment to engagement is really based around research. We know that the best predictor of positive outcomes for kids in our system is around the relationship between the worker and the family. So we really see that the model helps to support and promote positive outcomes. And then lastly is really the culture that we've created around continuous quality improvement. Those activities to support how we self-evaluate and self-correct as we notice changes in performance has helped us to really sustain positive performance over time. So with that, I'll turn it back over to the panel.
I have a quick question. I've heard you present before, and I know it's well addressed here about the confluence that you're experiencing between trying to get people out of the system and the reentry rate and the correlation there. And you've expressed several times that, that needs to be explored further. What kind of data would you need to be able to establish that relationship, or what the factors are driving that?
Are you talking about foster care reentry or maltreatment re-reporting?
Both, actually, yeah.
Okay. Somebody want to answer that? Want me to?
18. That's one of them, isn't it? Oh, draft 18.
Slide 18. Well, in terms of, let's talk about foster care reentry first. In terms of the foster care reentry piece, we can do a lot of cross-data analysis. Like, we know that most kids who reenter are older than 14. We know they're usually served by multiple systems, juvenile corrections, children's mental health, CP. We know that that kids that experience one reentry are more likely to experience repeat reentries. So there are some things that we know. I think what's difficult about the reentry work is that kids who reenter are influenced by so many factors. Some of it's family, some of it's our system, some of it's the court and the police. And so really to effectively dent foster care reentry is really that sort of work across those silos and bringing people together in focused effort. And that's when you start getting some of the data issues. I think we have the interest and the drive from all those areas to work on this. But when you start putting cross-systems data together, it doesn't always line up perfectly. But I think it's just complicated by the fact that there are so many causations for foster care reentry.
And what about the re-reporting?
So can I just?
Oh, I'm sorry.
So Chris, on 18, that was one of them. So how did they come up even with that? They've got a target of 10%, and we're in the 20s to, let's say, average around 20. It's almost double. Is that just? Is there some data based on that target, or how do we compare there?
So that target is set by the feds, and they look at performance on foster care reentry across the country. And I this is kind of tapping my memory banks, but I believe that it's 75%. Like, what is the 25% of states will make that performance goal, and so that at the time that they set the national standard, it was 9.9, and so that is how the state adopted that so that we're measuring to the best of our ability apples to apples. What's happened over the last couple of years is some redefinition of foster care reentry and a little bit of changes in the nuances of how that's measured. And so you'll see on this graph that the state performance stops in 2013, and that's because they changed the way they collect the data. So we couldn't graph it well. So what we've reported on is both the old way to measure it and the new way to measure it, so that we can have some integrity in our conversation about our performance. The bottom line is, no matter how you cut it, we're not even close. So.
And the one thing I think to keep in mind when you look at foster care reentry is the link between what we do really well, and that is reunification within 12 months, and those kids that reenter. And so it's not just even looking at the kids that reenter, but what is it that we're doing around those reunification and the timing of reunification to help make, how do we continue to have strong performance around reunification, but do we need to reevaluate how quickly or what goes into those decisions to impact foster care reentry.
Suzanne, just quick, in that vein, are there any measures that you gather that help us understand, even those kids who re-enter, if we have impacted them in a positive way, or if they have other things that, even though they re-entered, they are better off in X, Y, or Z?
I don't know that we have performance data. I mean, certainly as part of case managers' work, there's tools that looks at child well-being or mental health screens. It's not data, though, that's collected aggregately that we look at. Certainly, we'd like to believe that an intervention period by the agency is about connecting kids and families with needed supports, needed services to help get at, I think what your question is more that child well-being. But I don't know that we have great data to support that.
We don't. I would agree with that. We have 3 promising things, though, going forward, and one is the Crossover Youth Program. That is a program that, by definition, looks at kids served by multiple systems, so that'll be interesting to watch. We have some specific services now for sexually exploited youth that did not exist in the past. And we can see that in our current data, that those kids came in multiple times, maybe because we didn't have the right tools at those opportunities. And the third thing is, it was like really for me, one of the biggest learnings in getting ready for this today is a third of the cases that we opened last year involved kids under the age of 6 whose parents used alcohol and drugs. Like, that was phenomenal to me. We had never broken that out before. And so I think the opportunity to look at how do we address relapse and how do we plan for relapse and how do we keep kids safe and not have placement back into foster care be our response to relapse. I think those three things really hold promise that we might be in a better position to have conversation next year that looks different. I'm hopeful.
I have a question on initial screening and the slide on page 12. You mentioned that the state has established criteria that needs to be looked at if you're going to open up a case. How often does the state evaluate that criteria, and what kind of data goes into that decision making, and has it changed over time?
Well, it's changed over time. You know, the screening guidelines themselves are relatively, well, I guess not so new anymore, but they probably in the early 2000s, there was one that was kind of developed that was used statewide. Otherwise, we had 626.556, a statute that we all just kind of worked off of. And there were a number of counties that had put together some kind of criteria that gave some examples and just some direction that, to work on that. When the task force came out, there was a big revamping of that. And then again, they did it, that was in 2015, and now they've done it in 2016. So I think, and Suzanne, you were on the committee, and I don't know if they're intending to do that on an annual basis?
Correct. The intent is that they pull together, the Department of Human Services will pull together really a collaborative stakeholder committee to look at the screening criteria, sort of what's working based on statutory definition, is there reworking that's needed, and results of the Department of Human Services provides really monthly oversight of county screening decisions. So is there continuity around the decisions to screen in a report or screen out? And so based on some of that data, they pull together a group to review the screening criteria on an annual basis.
So do you think it's the changes in screening criteria that contribute to the increase in caseloads, that you're just screening now differently and it's opening up more cases, or?
Well, I looked at that a little bit, and clearly our number of reports that we're screening, that we're getting to screen has increased significantly, almost 300 from last year to this year, or from 15 to 16. But of that, Suzanne and I were looking at this last week, and it appears that from 14 to 16, we're screening in like 4% more of the total. So, I mean, it's affected us in either ways that we're looking at the screening guidelines or just the scrutiny piece. It's so hard to say. I mean, I feel like we've always been, our workers would tell you that we screen everything in. So, I mean, they're feeling like we're screening a lot in, but there's been some impact in the last couple of years, so.
I think from that community, the media attention around child protection has, one, created increased awareness from a public standpoint. And so certainly the good thing is I think there's more awareness and more direction and support from making calls to the agency if community folks are concerned. So as that volume continues to increase, and then slight changes to screening criteria certainly impact the overall trajectory.
Can I return real quickly to the re-reporting issue of the maltreatment? It looks like we've been meeting the standard for the most part, with maybe some deviation in 2016. Just curious as to, and maybe this information is somewhere embedded in here, and I kind of inadvertently skipped over it. When there is a re-report, what's the rough proportion of it for being the same issue, or is it?
Well, the data on re-reporting is not the high quality that we would like. It's accurate, it's just not very deep. And so really one of our identified next steps for next year, like what I would hope to be different when we talk with you next year, is that we can report out more on those specifics. Right now that's a hand count that is digging through the reports and looking at what's the same and what's different, and we have some opportunity to improve our data collection. So for example, this year If we screen in a report of children who are present when their parents have an episode of domestic violence, depending on the circumstances, that is likely entered as neglect. Now we have a way to identify that it's neglect based on domestic violence as opposed to a different kind of neglect. So certainly we're improving some of our data collection, but mostly we just need to have time and opportunity to dig into data that's tough to get. And I think it's really interesting. I think it'll be the most important work we do next year, is really, because what does that mean? Does it mean that we've left kids in unsafe situations? Or does it mean, like, for example, if we get a report on a physical abuse allegation, our worker might go out and do like really good work around that, and then find out later that there was something else maybe happening with that child that we didn't know or couldn't have known or couldn't have planned for. And so we just have to know that we're not missing things when we're there.
So I think that's part of that continuous quality improvement. Those are the efforts that we look at based on this year's, the 2016 data, to really dig in. I think we have some hypotheses, but we have to figure out, is that hold true? Is it related to those kids 0 to 5 with parents who are having substance abuse? Is it related to domestic violence? Because those are the areas that we surmise based on what we hear from staff and I think what we see from cases, but that's the work that we need to dig into.
On page 17, I was surprised personally at the target for the percent of kids to be placed with relatives. It was very low. I imagined it would have been a higher target. Can you talk a little bit about what prevents kids from being placed with relatives?
Sometimes it's that the relative wouldn't pass a background check. So when the police or the workers going out, they're vetting people kind of quickly, and still, so they'll run some background checks. They'll try and make sure that the home is meeting some standards. But I mean, if those couple of really important things work out for those kids, I mean, we want those kids to be with relatives. So, but those would be kind of the two big, I think, is a background check problem, and then just the physical environment.
So relatives who want to care for kids have to go through the same licensing process as any foster parent. And so through that process, like Beth talks about, there's background studies that might prohibit them from being able to be a licensed foster care provider, even though they're caring for a relative.
Is there a role that you see for the community? So you had put together that great flow chart that showed the different partners you work with, but I was sitting back wondering what are some of the things that the community can do to be better supportive of foster care? I mean, of child protection and foster care.
Yeah, that is such a really very good question. I think that for community members looking for opportunities to nurture kids and nurture families, like these are people who want to take care of their children. They love their children. They have barriers to being the kinds of parents they want to be. And so I think when the community has opportunity to look at how do we support healthy daycare, and how do we support community activities, and how do we support availability of mental health services and chemical dependency services, like any of those efforts that strengthen and kind of nurture those family systems, those are really good things in the big scheme. We certainly think that people who are aware of child abuse and neglect and are good reporters also help protect kids, and that idea of just sort of building that bigger safety network, like it's not just the 14 people on our team, like it's that bigger network. And Beth and her team do a ton of public education and mandated reporter training and that kind of thing to help just make our community more aware. I don't know, do you guys have other things you would add to the community piece?
I want to follow up on the mandated reporter training. How extensive is that? I mean, is it like a 30-hour over a period of 6 months, or?
We go out, and if we can get an hour and a half,
Okay.
because people are busy, and it's either going out to the schools at a workshop day. We were just over at and did a community corrections one. Tim was there the other day. I think we had an hour, which is a tight fit, but I mean, we can get through kind of what the details are in terms of what it is that they're required to do as a mandated reporter, and then also just some of the screening criteria. So people have not the ability to screen anything, but to understand what is reportable and what isn't.
To identify the signs.
Right.
So I want to go back to what Lori hit on a little bit with the community, and as we're talking collective impact and these things we're talking about as an org and then with our partners. One of them, when you were here before, you talked about drugs, you talked about chemical abuse. What about housing? Have we made any progress? Have you seen, that was a big one you guys talked about. I went back and looked at a year ago's presentation, but that was one, some of these pressures families are facing that lead to these crisis points. Have we seen any progress there? Is there anything taking place in that arena?
I think it just really remains a problem. I mean, a lot of times that's kind of one of the barriers, not that it's, prevents entirely somebody from getting even their kids back or, you got to have a good, safe place, whether it's even staying with someone. It continues to be a real problem.
I think what we, I'm sorry, Beth.
Go ahead.
I think what we see is oftentimes, some of the time, we have families who come to the attention of the agency and for a child maltreatment report. That report might be screened out, and then it goes to an early intervention program, our PSAP program. And what we see repeatedly is the issue around housing need. What we don't know is if we're unable to meet that need through the early intervention, how many of those families end up either related to housing or other factors coming in later through the child protection system. So I think the housing is a good question, Leslie. I think it's just an ongoing concern. Certainly our folks, clients and families that we're working with, oftentimes poverty is an overarching factor. And so the solution to poverty is obviously multifaceted, housing being one part of that.
The other one that you talked about was education, and again, that's part of it. These kids, do we know any more data, or have we done any work yet on how they cross into their educational success or those types of barriers they're facing? I know even sometimes you have to move them out of their school district, correct?
So federally, there's efforts to really promote and support through policy and statewide educational stability. Certainly when kids come into foster care, we have to really look at how do we preserve and maintain them in their existing school district if it's in their best interest. So it's actually now through a federal act, we're required to really be partnering with local districts to look at how we would even fund the transportation then. So if a child is placed out of district, who is going to fund the transportation? And so that's work that's just really starting here in Scott County around the agency and partnership with the local districts of what that will look like.
There's also a private foundation in St. Paul that's starting some research work, and they're working with the Department of Human Services and Hennepin County on collecting data related to child well-being, so education, physical health, mental health. And that's a relatively new initiative, but is really geared for like what data could we collect that would be most helpful to child protection workers, and what data can we collect that would be most helpful to supervisors in monitoring that well-being needs for kids are being met, as well as safety and permanency. So that's kind of an exciting thing. That'll be kind of fun to watch, and they're a private agent or a private foundation, so they have some research and some money and so that'll be kind of an interesting thing going forward, I think, to see how can we link up our outcome measures with some educational components.
I had a question about signs of safety, which seems to be the preferred model of choice because of its integrated approach to attacking these problems. How many of our Collier County friends are using the same signs of safety type program? Do you know off the top of your head?
How many of our what?
Just other counties?
Yeah, throughout the metro or whatever.
I don't.
Oh, go ahead.
I don't know that I have a complete number. Mm-hmm. The model really is used internationally, so it started Western Australia. I think there are probably a dozen counties who would consider themselves and have implemented signs of safety. I think there's a whole host of other counties who have parts of the practice. And again, I don't want to speak for other counties. I think it's the time intensity and the skill level of the staff required to be able to do the work within the model is certainly a complication.
Sure. The reason I ask that question is that if a child is placed outside of Scott County, is there a continuity of service, or is there continuity of attention paid to the same level of scrutiny that they would have expected in Scott County?
So if Scott County ends up placing a child, for example, with a relative or in a foster parent in Hennepin County, Scott County continues to be responsible for the care and well-being of the child. So we follow the child and the work with the family.
Great.
Suzanne, how can we better support signs of safety here? So I know there was a lot within the materials about gaps, and while the Governor's Task Force has done great stuff, there are other partners who weren't provided resources to help support kind of this new system we're moving to. So what can we do here in Scott County to help support your signs of safety and that successful system?
Well, I think Scott County is a very relational-based organization. It matters to departments that we work together. It matters to administration that we work together. Individual people feel strongly about the value of collaboration. I think those things are important. We work really closely with the county attorney. I think certainly we have shared our data and review that data in a variety of venues. So that recently we brought our data to the Juvenile Justice Committee, where both the judges and the county attorney's office said, "Oh wow, like no wonder we were feeling like we were really feeling this, because the reality is there are just more cases." So we work in cooperation wherever we can. We share the data we have. We help support their efforts if staffing or resources are issues for their offices. But it has been a struggle as that increase has happened for us.
I think we have by history been able to support really keeping caseloads on the lower end of average to support the time intensity that's required. So as the pendulum has shifted and swung, that has complicated the worker's ability to, I think, do the intensity of the work.
And that's a hard thing. Julie, you're probably in a better spot to speak to this, but it's a hard thing. If we can work with families voluntarily, if we have the level of intensity we need to work with families voluntarily, then we can keep them out of the court system. We can, so some of those things, like you start to see workers spending more and more and more and more time in court or waiting for court hearings, and the court calendars are going up and the attorneys are strained. And then if we move those resources to the front end, if we can have that intensity in the front end, we can maybe avoid all that. And that's one of the pieces that Signs of Safety has brought us, is this really sophisticated level of safety planning for kids and families, and it certainly improves our chances of being able to come up with a safe solution.
Right. I think what I would add to that is one of the big shifts with Signs of Safety is that, the workers need to be able to have the opportunity to be in the field, in the family's living room, doing the work. That's a big shift. It used to be that we would go out, gather lots of information, come back and kind of talk about it. Now, what are we going to do? What do we think is best? And then go back and put that on the family. And really, to do Signs of Safety, you need to be staying in that family home, staying in that living room, working that through with that family. And that just takes a lot of time, and that's different than the work that you would do in court or engaging other professionals. You really need to engage that family.
I can think of one example several years ago from a veteran worker. It really was about out at a home and domestic violence, whatever the presenting concern was. But the worker was really saying, look, I don't think I can leave here today without something being in place for your child. So, how do we do this today? Or I need to look at foster care as an alternative, because that's what I bring to the table. So do you have grandma? Do you have grandpa? Do you have aunt? Do you have uncle? Do you have next door neighbor? And really the worker waited and helped as they organized people to come to the home and really evaluate and establish what needs to happen for that child to remain safe in that home, and who was going to be partnering with the agencies to help assure that we knew that, in fact, what the group and the network agreed to was happening. But again, it takes certainly time and resources to do that.
Deb, can you go to page 11? So the timeliness. This looked like a real positive increase for you from 14 to 15 to 16. Did you make a conscious change, or what drove that positive increase?
Well, the truth is that the state attached a significant amount of money to meeting that performance measure. And that's the truth. And the other truth is that is our best way to make sure that kids are safe is to get out there. So now you have workers who are driven to do that and supervisors who are watching that every single day and a reward at the end. So it's sort of a good.
How are you monitoring it internally when that first call comes in to knowing when that initial contact took place? How are you monitoring that on a daily basis?
We've got the social services information system that we put in. I mean, everything from we get the report, we type it in, there's a date and a time attached to that. We've got 24 hours to, assign the case. And then at that point, it's date stamped within the system. It's handed to the worker. If it's a investigation, they've got 24 hours, and they come back and they put in the time that they saw the kid, and that's all then in the system. And the same would be true with the family assessment, where they've got the 5 days. So it's all just really slick reporting for us.
So we can break down really monthly of those cases that are 24-hour response, what's our percentage of timely contact? Of those that are 5-day response, what's our percentage of timely contact? So we can assess, is this across the system? Is this a particular case type, a 24-hour versus a 5-day? So that's all data within our state system.
This data is really high quality, and it's high quality enough that we use it in all of our performance evaluations, that an individual worker's timeliness is reported as part of their performance evals. And it's interesting, Suzanne mentioned that we had 2 recent resignations. We were interviewing a woman on Friday, and she came in and reported her timeliness stuff so like just within the child protection world, that's just
So it's one of the most key things you do. All right.
And is it a contact with the child or the family or both when you are measuring that?
It's face-to-face contact with the alleged children who are alleged victims. So we still have an obligation to see, obviously, parents and siblings, but the timeliness measure itself is with those children who are determined to be alleged victims.
Mm-hmm.
So it's a nice thing that we've got that I know a lot of other departments don't have that ability to have that good of data.
Yeah. So. And honestly, most of our staff come forth and tell us, like, it is, if a worker doesn't meet a timeline, we're pretty likely to hear about it from them before we even see it on a data report, because it's just so much of our culture that people will come in and do true confessions or explain what happened or whatever.
If they don't see the kid at the home, they come in and say, I'm going to go out and see this kid at the school without the parents' permission, and we have to sign something. I mean, they're just, they're pretty on top of that.
Within your write-up, you talked about a certain set of kids that you can't get to because you can't find them. Have you thought about or talked about ideas to get at that group, whether they be homeless or, I think homeless is what you had called out?
We do some Facebook stuff. I just feel like we have been pretty creative in terms of kind of finding out maybe where they might be, but people can be if they don't want us to find them. And there's some pretty mobile and they can disappear on us pretty.
Right, we work with law enforcement who oftentimes has a lot of contact information that we can't otherwise get. We can put alerts out for if it's a family that's going to apply for assistance. And if we're not finding them, we've done a lot to try to locate them first.
Sure.
I think the other piece of our effort is to make sure that the efforts that the child protection worker is making to find them kind of rise to a level that we can all agree is aggressive enough, that we're that it's not like one time by their house, but that we've really put in that extra effort and the extra work or after hours or whatever needs to happen to try to make those contacts.
Lisa, can I just go back to, you had talked about the re-entry on the foster care, and one of the things that we didn't talk about, and just because that's not one of our greatest pieces of data, I just wanted to point out that it's a small number of kids.
Yes.
That we really struggle with the fluctuation of that, because you suddenly have a sibling group of 4 that goes back into placement, can really just
Skew your numbers.
Yeah, right.
The proportions are, yeah.
I noticed on page 12 that even the facility investigations are up quite a bit. Is that just, again, because you think the publicity and things like that? I mean, that's like 500% increase.
I'm not real sure I'm just trying to think of, I hadn't really looked at that, Leslie, so I'm not real sure what that is about. Because we're not really doing a lot more on like the relative.
Well, I wonder about the screening criteria of like unlicensed providers that come in now as facilities. So I think there's potentially some changes within the screening criteria. Again, as a result of some of the systemic reform that just impacts sort of the volume within that particular category.
Because it's still like 14, that was 1%, 15, that's 2% of the total, 16, it's still just 2% of the total. So percentage-wise, I mean, it's a, you know.
Yeah. It's not a big percent, but
But it's
that
the
item
number
itself
itself. Yeah,
was
right.
considerably larger. Yeah. This is one where you had mentioned last time even like some of the ages of family and income and ethnicity, and it sounds like you did find out 6 and under and drugs and chemical dependency was one of them as you were looking into that was came specifically out of some of that. So that's interesting to see where that will take you then.
It is. It really is.
Earlier, you talked about a strong and stable workforce being critical to our good child protection efforts. And within your write-up, you talked about secondary trauma and new information coming out. What can we do as the employer to help support the workers who are exposed to this?
Well, we had a couple of pretty specifically or traumatic kind of events that have happened in the last year. One in particular that we tried to respond to in a different sort of way, brought somebody that came in from Sand Creek, did some work with us, both individually with the worker and then with the team. So, I mean, we're working on learning how to respond to that. I think we did some things that, in hindsight, we would do differently. We're learning. And unfortunately, you know, these things come up, so we want to make sure that we develop ways of responding that are helpful. And
do you see, like our EAP, so Sand Creek is our employee assistance program, do you see them responding to this new literature and helping maybe other agencies as well as you and us to respond better? Is that something HR directors can get involved in and try and support?
Yeah, I think it's unclear. So this is the first time we've done a formal invitation and had Sand Creek come in to do really a debriefing around a traumatic event. And so in the past, we've made some invites or had some discussions with Sand Creek, and those, for a variety of reasons, didn't go well or go as we had hoped or anticipated. Sure. And so I think it's an ongoing sort of evaluation and conversation. We've had certainly somebody from Sand Creek come in just simply for training. So even separate from like a critical incident debrief is how do we as supervisors, leaders, help educate staff around like the importance of even work-life balance, because when things are busy, that can get skewed. And again, we know that we can lead to burnout. How do we educate staff around signs, symptoms, and secondary trauma? How do we normalize accessing a VAP as a resource, that it's not looked at as like something's wrong with me, or but really normalizing that as a support for staff.
Good. Okay.
I think that from a policies standpoint, there's opportunity. Like we have policies in place here in Scott County that support our child protection staff being able to flex some of their time, so they can get that relief. They can spend time with their kids. They can go to this school program because they're going to work tonight. You know, those kinds of trade-offs have been helpful for employees. Sure. I think that I think conversations like this actually are really helpful because it forces us. I'm so sorry.
You're busy.
No, I really thought that was off. That's the police. They probably called you first.
I might want to get that.
Do you want to talk to him? I mean, I'm the ugly stepsister to Mahoney, so she always gets the calls first. They're desperate, or they wouldn't be calling me. Where we? Oh, like conversations like this are really helpful because, like, we can run around all day going wham wham. We're really busy, you know. Like probably lots of you have people in your departments that do feel like just the weight of all the work. But the child protection worker, even working in a really good system in a good collaboration, like at the end of the day, they have to make this decision: is it safe enough? And there is weight to that. Like other people are going to go home at 4:30, and that child protection worker is going to make a decision about, is that safe enough? And we hope that we have good supervisors and good administrators and good support and like the people around these folks that are making those really tough decisions and carrying that weight. And then we have to be able to make sure they have time to replenish and regroup and be healthy, because we want to match them. We want, when a family with such extraordinary needs comes into our office, we want to be able to match them with somebody who is skilled and talented and fresh and has all the judgment that they need to make those hard decisions. And like third floor, we are extraordinarily fortunate to have people like that sitting up on third floor.
Following up on the secondary trauma issue and what we can do to support, is there ever times when a caseworker feels like they're in physical danger when they're doing home visits? And in that situation, what kind of resources do you have at your disposal, or what would you need?
Well, we use law enforcement a lot. I mean, hopefully, I think workers are good about talking with supervisors ahead of time about any of the potential concerns, and everything is cross-reported to law enforcement, so we're having conversations with them about what are your contacts with this family, should we be going in there alone or not. So they're a big resource to us, but also workers will bring another worker out with them and go through training about just sort of assessing your situation, because you can walk in and think everything's fine and then it all changes on you, and just being able to observe that, see that, and be comfortable saying you need to leave if you need to leave, or calling law enforcement while you're in the home.
And all staff have cell phones, so they've got mobile access should they need help. Certainly, I have some interest in exploring. I think there's technology out there like GPS that provides opportunity. If somebody is down for some period of time and we don't hear from somebody, it enables us as really supervisors or leaders to be able to track, like, is there something? I think at night, I mean, people go home and workers are out in the field, and so I don't think we have a good way of necessarily managing that or monitoring that. So I'm curious of just what technology needs might be out there in the future.
So can one of you tell me what graph 19 tells you, or page 19, the rate of entry into per 1,000 that looks kind of statewide, regional-wide?
So this just really looks at, there's not a target, but it really looks at how many kids are entering the foster care system. And we have a statewide map, so it compares all counties. I looked at or put in here counties, either metro counties or counties of comparable size, to really look at how are we doing in terms of really our efforts to prevent kids from coming into placement unnecessarily. It's an area where we have had strong performance, generally one of the lowest. That continues, but it is also creeping up. Obviously, in some of the other slides, our rate of placements or number of placements is increasing. And so this is, I think, just to capture that the culture here is really how do we do the very best work we can to prevent kids from entering our foster care system when they don't need to. And as we look at, obviously, some of our other county parts where that range is, but also recognizing we've got higher rates of kids coming into care now. 2 more this morning.
Oh, boy.
So this is a positive one. It's not indicating we could do more in foster care versus placement or something like that. This is a very positive. Very good.
Wow, what's happening in Stearns County? Wow.
Yeah.
When you look into the future and know the demographic changes we have here in the county and the population growth forecasted for the county, how do you kind of anticipate that will change your services, and how are you thinking about that in your business plans or future plans, whether it's staffing or technology or anything else? What are some of your thoughts?
Do you want to talk about business plan? Okay. Well, I think that we look at a couple of things. We look at just growing, just looking at the population base. We have, a growing number of immigrant communities. That's presented some unique challenges for us. We look all the time at new partnerships. I think we have in the work that we're going to do over the next couple of years focused on domestic violence and early childhood, like involving in a different way in those early or those cases with small children, I think we have a really nice opportunity to work more with public health. I think all the time we're looking for how do we best influence the community through our partnerships is really the best thing, I would say. I don't know, like we're always looking at, do we have adequate staffing resources? Do we have service delivery? Can we get into the mental health center when we need appointments for families? We haven't had extraordinary wait lists for treatment beds or specific mental health services, but we're starting to see that. So that's a little bit of a worry. So for me, I think we have such an ability with our CQI system to look at cases and see emergent areas of concern that I think we're pretty good. Like Suzanne used the term self-correcting, like we're paying attention to things that are kind of on the bubble. And that really is how we've approached the longer term planning is kind of being aware of what's out there and trying to intervene before it gets to be a great big thing. I don't know, you probably have a better business plan answer.
Oh, that's fine.
Okay.
I'd like to ask you a public service announcement type of question. Are you still looking at recruiting more people to enter into the foster parent situation?
Absolutely. Yes. It's a significant need.
Okay.
As we look at, obviously we have a growing population of kids who are in relative care, but even again, despite that, I don't know if our foster care licensing supervisor is out there, but we have, of the traditional homes that we have, I think we probably have placements in every one of those homes. And so from really a capacity standpoint, those homes are likely full or close to full, and so it is really the broad range of need that we have around foster care. And while I hope we begin to see sort of some stabilizing of what's happening, the foster care continuum is always a need. How do we have adequate resources for those young kids? How do we have adequate resources for older youth who obviously present with different needs and different challenges? So yes, it is a growing need.
And they should check our website if they're interested.
Correct.
Right? Okay.
Great. Very good.
Nice, Lisa. I know.
Brad, anything else, or should I open up? All right, we're going to open up for questions to the audience. Judy. Judy, you need to go to the microphone. I should add that. You need to go up to the microphone so we capture it.
Which really discourages people from asking. Going back to the issue of foster care that you talked about, but one of the questions I have, your population that simply has come through intake has gone up significantly. Have you compared the increase in the number of children in foster care to the increase in your overall population? In other words, is our percentage of children in foster care really going up, or is it staying more the same and simply mirroring the increase in the children coming into the system?
I think it's probably the latter, Judy, in terms of the volume has just increased, and so we are seeing that. I don't know that the percentage overall is necessarily an increase. But from capacity around like foster care, we certainly have seen some of our traditional homes, there's been turnover in our homes, and so we've not been able to replenish. So even though despite the overall percentage of foster care isn't perhaps increasing, we need to have increased menu of foster care providers to meet the need of what's coming in.
But then would it be accurate to go back to your concern about the capacity of your staff and their ability to prevent placement, that even though you may not be increasing the percent of children going into foster care, that could change if you're not able to maintain the capacity of staff?
Correct. I think that is a significant concern in terms of the ability to do the front end work. We're certainly seeing the increased pressures from a court system again, signs of safety isn't, I don't want to present signs of safety as that it's a cost-saving maneuver or a placement prevention, but that intensity of the work up front can prevent, as Chris mentioned earlier, sort of the downstream of families getting less involved in the system.
Thank you.
Jake. standing, so I just called him.
Well, I wasn't standing.
Getting ready to.
He's just tall.
Thank you. Good job so far. It's an interesting presentation. You touched on it a little bit. I think Chris gave a response about placement not being a response to relapse or some other adverse event in the home. And the Board of Commissioners approved their 2017-2019 strategies and objectives, and one of them is it's related to child protection. It's a little bit like the MnDOT Towards Zero Deaths goal, that it really is focused on a community strategic plan that prevents the need for child protection. You have us, it's early 2017, I realize that, but do you have a sense of where that might go and what you really mean by community? Is it just different departments in government, or is it really going to try and reach out to the residents of the county, nonprofits, and other entities to try and figure out how you can move toward that goal? You probably won't achieve it, but how do you move in that direction?
Yeah, I think it needs to be broader. If we're really talking about how do we prevent families from the need for child protective services, I don't think that's government alone. And so I think collective impact certainly is a place that influences that, how we look at the development and supports for young families, kids 0 to 5, and who else needs to be at the table. And so that's certainly part of my evaluation right now is what is collective impact and some of that work, and how does that potentially parallel engagement with different stakeholders to bring to the table, again, who are the voices that can help us as a community really look at preventing families from the need to enter that system.
I have one other question. Signs of safety, you talked about that a little bit. Was there something in 2008-2009 timeframe that prompted Scott County to adopt that model, and if so, what was that?
So I think there was a number of things. The primary, we were seeing certainly high number of kids in placement, but along with that we saw, I think the court system seeing other professionals as sort of the driver or decision maker on cases rather than the expertise of the child protection worker. And so this was really an opportunity to, one, reclaim, I think, the expertise that child protection brings to the table, along with some increased attention to how are we working with families in a more collaborative process versus, like Julie talked about, going out, getting the information, coming back, and like making a case. How are we just in the room with the family trying to look at what are the needs and how do we work together to prevent further involvement, whatever that might be. So there was sort of a multifaceted, but it was about really reclaiming, I think, the expertise of the child protection field to really know what would be good for kids and families to alleviate whatever brought them into the attention of child protection.
Thank you.
No, you go ahead, Dan.
So I had two questions. The first being, it's my understanding that there's some housing vouchers, I think there may be Section 8 vouchers that your unit is able to prioritize households for. Can you just speak a little bit to how have they been able to be utilized easily, or have they not been utilized due to lack of housing options or the ability to find a suitable apartment or affordable apartment, for that matter, to utilize those vouchers in?
Well, I've got one right now. It's actually a parent support outreach parent. She got a FUP voucher, and it stands, what is it, Family Unification. And we got really excited. She got the voucher and then couldn't find a landlord who would be willing to, both from a rental amount and then just even all of the different changes to the home that were going to have to be made. So, I mean, we had to get really creative and talk to some developmental disability providers. It's just like you have to kind of tug at people's heartstrings almost to get them to kind of go through the rigor of, getting their rental units up to snuff, and then just to take a lower rental amount than what they might often, be able to get otherwise. So, still some struggles with that. Yeah.
Well,
the voucher itself doesn't always get you the housing.
Right, for that family, but those vouchers are all, like, somebody is always getting that voucher. They don't sit open. I mean, we try to work in a really supportive way, and the CDA does a nice job of putting together a folder for all of the families, and there's a list of the housing partners that they have that are familiar with their program and will take them in. Some families have some barriers, but then it will be fit with another family and not sit open.
I think that's a struggle, that so many of our families come with so many barriers to housing. You know, they have criminal histories, or they have, you know, maybe they have past evictions or things related to substance use, and then now they're out of treatment and trying to get things together, but they have all of this past that they bring with them, and just trying to advocate for people to be able to use those vouchers. We have 25, I think, that are available to child protection, so they're pretty hot commodities when they become available, and we work hard to get those families into those housing if we can.
And then my secondary question, and to put this in context, I'm the housing coordinator for the county, so I work with the homeless and low-income individuals through other vouchers and work with the nonprofits in the community to take and do that. One of the things that we're seeing more and more is that when we have vouchers come up, they're for single adults, and then we find out in the process of locating housing that they're actually part of them, their desire to get back into housing and their work that they're doing is also so that their children can be returned. And so my question is how often is there a delay in family reunification, or is that a common occurrence that the parent needs to locate the housing, and that's part of the thing that's delaying is that their need to find a unit so that they can have the children returned to them?
Well, those families, you probably know this better than I do, but the FUB program is really designed either to keep kids out of foster care or to expedite reunification, so to eliminate the exact problem that you are identifying. The truth is that 100% of our kids went home within the timelines last year. Now, that's not to say some kids might not have gone home more quickly, but usually by the time we get to that point, people have housing, or they're sharing housing with relatives or friends. We work in a lot of cases where people go back to mom and dad if that's a safe place for them and their children. It's not, in my experience, it is not often that we are delaying reunification because we can't figure out another way to do that. Because by that time, people are more stable and maybe they're sober and all of those things.
Thank you.
All right, just one quick question about fathers. This is an area that actually, as you guys know, goes back to 2003, has been a challenge for us, has been identified in our continuous quality improvement. So I see it's still listed here, so I'm just kind of curious what you guys see as both the barriers to that, because we all know that if we have both parents involved, is our better chance at good outcomes for kids. So both what's our barriers in that area, and what are you guys seeing in terms of strategies moving forward, as this is something I know we've looked at for a long time?
Yes.
They're going to be sorry I got up here.
So here's what we know today. So we have a process to review cases, and the continued need to improve our work with fathers comes out of those case reviews primarily. And it is a humbling thing. You know, Steve Brown reviewed a case for my team the last quarter, and he rated a bunch of things as needing improvement because we hadn't engaged the father. And it's just like, seriously, how many times can we talk about where's the dad, where's the dad, where's the dad? And yet it continues to be a struggle for us. And often those dads are non-custodial, and so they live somewhere else, maybe in another county. They maybe have a different level of interest in working things out if they're not primary caretakers for their children. But sometimes they're really involved with their kids, and we're still not doing a good job of bringing them in. And so I think that there is opportunity. We also know that sometimes we get them like we get them in the assessment phase and then we lose them when we move into case management. And that's the piece I think is really interesting to learn more about. Like, how are we losing them? Because it's the same worker, it's the same conversation, and yet we're losing them somewhere in that process. So that's the work that is part of our program improvement plan for 2017. We have a lot of young female staff, and so I think that there's something, like, we have 2 men on our team, so if we had more men, that might help as well. More examples of fathers.
Anybody else? So for 17, I usually ask at the end what you would hope to see or work on. It sounds like fathers is one of them, the drug and chemical dependency. Anything else, if you were sitting here a year from now, that you guys would like to hopefully see?
Well, I would hope that we could give you more specifics on the re-reporting data. That, to me, I think we really have some responsibility to bring forward, so that I would hope we would be able to speak with more clarity about.
I think to understand that begins to even drive some of what we've already talked about, the 0 to 5, that we need to understand that data better or differently to help inform what some of our next steps are. Because really, ideally, our best hope is that a child protection assessment is the first and only touch by child protection. Like, that's what we want. We recognize certainly families' systems are systems and they evolve and change. But that is our best hope, that if child protection needs to get involved, that it's a one-time, and then the family has the skills and capacities to safely parent. So,
Beth?
It's been a couple of pretty tumultuous years, and so just a little stability and just some time to do some of that work that we know is so important for us to do our work better. So I think if we could get accomplished, those number of things, I think it could make a lot of impact potentially on the work that we're doing with families, especially the upfront work.
I'm not sure how this fits in exactly to the question that you're asking, but one of the things that we're taking a look at is what we call mapping our safety plans. And I guess I'm excited to see how, when we're examining like the strengths and the weaknesses of the safety plans that we're doing with families, how that might impact our work in a lot of areas, maybe to the repeat maltreatment, maybe to reentry.
What's working and what's not, and best practice. Cool. I'm going to turn it back to the chairman for the board to ask questions or...
Thank you. Just one observation as I've been sitting here watching. If you'd all take those name cards and just turn them perpendicular. Yeah, now we can see who you all are. And I'm sure you all know each other. Next time we set this up,
good learning lesson.
I'll ask that first time out. Members, any comments or questions about anything we heard here today? Other observations? Let's go with Commissioner Wolf first.
You said earlier there was some resignations, a couple of them. Is that a blip or a trend, or why is that, do you think?
I don't know that we know. We know why people are leaving. We have experienced low turnover by history. I think certainly one of the individuals is leaving to pursue some different career opportunities. But I do think it's a place that we need to watch, is the workload and the chronic stress or experience of secondary trauma. How is that influencing the current workload and workforce to know, are there interventions we need to look at differently?
Good observation. Thank you. Commissioner Ulrich.
I'm wondering, I'm looking at some of these numbers, I'm wondering, the 100% of reuniting children or with their families, you had that rate within 1 year, that those that are reunited with their families at the 100% rate, and yet I almost wonder if that goal is too high, or because if a quarter of those kids end up back in foster care, did you put them back too quickly? Did you evaluate the situation? This is referred to as a chronic problem. It's as high as 30% in some years. To me, I don't think it's anything great to trumpet that the 100% got reunited within a year with their families if a quarter to a third of them come back. To me, it's, I'd rather see 75% and have 100, have no return, you know, I mean, I don't know.
I think that's a keen observation. It is a delicate balance of how are we know that longer time kids spend in placement, like that's not good for their well-being. They are disrupted from families, from communities. But you're right, a big percentage of our kids are coming back in. So how do we look at that balance better or differently? What we also know with our reentry data is that those kids are generally coming back around 90 days. And so, you know, a relatively short period of time. So what do we know about our reunification process and decision making, and how do we evaluate that, again, differently to look at that reentry rate?
We agree with you. We would rather see the 75% everybody stays home permanently. Like, if that's the right balance, it is a really gut-wrenching thing to go back out and tell a child they're going back into foster care. Like, that is a really difficult thing. And we want kids to go home and stay home, and if that means we're not hitting 100%, then that's a better outcome overall.
And the other piece that I think we also need to do is the ongoing support and communication with like our law enforcement partners, because again, their kids should really be coming into foster care or out-of-home placement only due to child safety. And so do we, however, at times get kids and families when there's a conflict and they end up coming in because of the conflict, but not necessarily imminent danger or safety. And so are there different resources and ways to partner with law enforcement to assure that those placements aren't happening, that only really placements due to safety?
Foster parents, foster care. I'm just curious about that. As people would be considering becoming a foster parent, you know, probably one of their thoughts is, well, what kind of risk would this present to our family? You know, taking in somebody, how much, you know, some of these kids really may have present some real difficulty in the foster home. What kind of issues come up there, and what kind of risk is there to somebody to being a foster parent? I'm just curious about that. You understand my question?
Mm-hmm. Yes. And it's unfortunate Gretchen's our licensing supervisor isn't here. There's a fairly in-depth orientation and training process that foster parents go to, and I think you're right. I think people do have worries. How will this impact my family? How will it impact my children? You know, am I exposing my family to things that I don't necessarily want to expose them to? And I think some people sort of self-select out of that process and that orientation piece. But I also think we provide really good support to foster parents, and we work at that all the time. And many come in working with a relative placement, but not all. Some of them are just people who want to do a good thing, and we've been able to support them through that. We protect foster parents if we feel there's a need. We're pretty transparent with them about the risks, and people make good decisions. I think the really amazing thing is that most of our foster parents go so far above and beyond what we feel like we could reasonably ask them to do, that it's just sort of it's a gift to have them, really.
I think the more we can really bring them, the child protection worker, the licensing worker can bring them to the table with the kids and parents, I think it can begin to dispel some of the anxiety or potentially even myths that you might have about families who come into the child protection system and really just relate as two moms or two dads. And really we see foster parents then begin to engage them as, like, what do your kids like to eat and what do they like to sleep with? And then there's a real joining, and we again then begin to see that development of safety networks beyond just their placement, that we hope that those relationships are built over time.
Mr. Beer.
Yeah, I would just like to say thank you for doing that hard work. That's the front lines, as I see that. And this is, to me, I choose to believe that this is one of those jobs that is a calling, as opposed to, oh, there's an opening in the government, let's go get a government job in Child Protective Services. So thank you for doing that work. One of my questions is, and maybe there's not an answer today, but it's on my radar screen, is you guys are going out in brutal, I think you guys use the term heart-wrenching, gut-wrenching. I mean, I can only imagine. That's all I want to just imagine. So as you're pouring yourselves out into this, pouring out yourselves, pouring out your buckets, how do we come back and fill you back up so that you can go out and do that calling and do it well and not get burnt out or worse. Like I don't know what programs we do or how do we make sure you're going out with a full bucket to pour out on those people you're serving?
Well, first, I just want to say, thank you for saying that, because I think you're right. How we support our frontline staff is really critical. They are the ones who make the difference in terms of really producing good outcomes for kids and our families and our community. I think some of the things we talked about are around sort of alternate flexibility within their schedules. So we have some folks who work alternative schedules. They have ability to flex time so that they can attend to their own personal family needs, which again is critical. If you're forced to, I got to make a decision between going to my child's conference or working, if they feel like they have to make those choices, they're not going to stay. So I think the increased flexibility that we can have and that we do support at the supervisor level, in addition to some additional work that we need to do about educating ourselves, educating staff around secondary trauma, what are the supports internally that we can provide to assure their awareness, and then the ability to access services when and if that becomes a problem.
So you feel like there's at least something there to ensure that does happen?
Mm-hmm. Other comments here?
Yeah, and we're really lucky. They talked about the staff turnover being low, and I've worked at 2 other counties in child protection, and we've got a really extraordinary group of people that are working here right now, and they look out for each other too, and we give them a little bit of latitude to make sure that they're keeping track of each other, and as much as we try to keep track of all of those people, more often than not it'll be somebody coming up and saying, I'm going to take that assessment, she's not okay, or she's really busy, they just really stick together. So to the extent we're sad to see these 2 leaving, it is a real loss.
I think the other pieces within the signs of safety model, it really emphasizes sort of the need for group or team decision making, so that the case isn't just my case or Leslie's case, that there is support around the decision making process, so you're not holding the weight of whatever decision is made. Hopefully helps to reassure folks making those decisions.
I want to say, I'm just going to add my 2 cents here, that they have presented before with the attorney and the sheriff, and this is done by multiple folks. But these 4 are 4 really incredible supervisors and managers within this organization as well. You heard them talk about data and performance reviews, which is something Commissioner Ulrich has talked about. They have advanced that. I think the signs of safety, you've heard this incredible number. I'm going out on a limb here that Hennepin County talks about. We're doing that already. They're leaders in that. I think they're perceived as leaders. Suzanne sat on the governor's task force. They're an incredible group of people sitting here presenting today and put a lot of their own heart into this and how important their employees are. And I think you see it reflected in why they stay as well.
Thank you.
Other questions or comments? Commissioner Breckney?
Well, thank you, of course. As I'm sitting here, my biggest takeaway is how we as a board, how we as a community can better utilize all the things and do just what you said. You said, how can we prevent child maltreatment? We need to nurture families, and how can we encourage people and just give them the tools, because it's something that I don't think we think about, or we think about it later after we see a way we could have nurtured families. And so that's something I really want to think about and hopefully get your expertise on in the next year, because I think we can do a better job of galvanizing the rest of the community, because, you would rather not have such a busy caseload. I get it, and I think you're the people to tell us how we can do that. So I look forward to that.
Just to kind of follow up on Commissioner Ulrich's and Commissioner Beer, I guess, his comments about what do we do to keep your bucket full. And just know that we do pay attention to that mostly through your work as managers and supervisors. Commissioner Wolf and I sat in a brief discussion. Actually, it was a pretty intense and not so brief discussion a couple of weeks ago regarding some of our detectives and some of the stuff they have to immerse themselves in every day and slog through things that you can't unsee and things you can't unhear, and what that must do to a man's soul or a woman's soul. Have to be into the middle of that. So we bless you with some extra grace to kind of keep your hearts strong. And again, thank you for the calling, and know that we are aware of those things, and how it's probably a little different than plowing snow, which we appreciate a great deal too, especially on Friday. But, these are things you're doing every day when you're in people's families, and that's a very touchy and sensitive area that we care very much about. I just have one last question, I think, before we wrap it up. We had some discussion, I think, in a workshop, Leslie, about the emergency response. I think you have to touch them within 24 hours. What happens to the call that comes in on Friday afternoon at 4 o'clock? And there had been some talk about some almost like float pool people who specialize in being on call on Saturday and Sunday or something like that. Am I remembering that correctly, or how are we doing with that?
I think Pam at a chair vice chair had talked about that.
Yeah,
That's where that was,
Susan,
yes.
I can probably speak to that as well as I can. And you're absolutely right, Commissioner Beard. It's been a challenge for us. We do actually have a contract right now with Canvas Health.
Okay.
And they are a nonprofit that is available to take calls 24/7. So on our after hours, evenings, and weekends, they will take calls. If there is a situation of imminent danger, they will make that first face-to-face contact. And then we've worked out mechanics in terms of a handoff that it is still our workers then that would follow up and do those investigations and such.
Okay.
And the piece that we had brought to Chair Vice Chair really related as well as to the Department of Human Services is saying as of July 1 that we can no longer contract for that service, which is of concern to us because as these folks have chatted with about today, we're very, very concerned about the workforce in that area and maintaining a healthy workforce. And so for us to look at staffing that evenings and weekends, it is not, I don't believe, in our workforce best interest. So you are absolutely correct in recollecting this conversation.
Thank you for refreshing my memory on that.
Do you want to say any more than that, Suzanne?
Well, let us know how we can be helpful in saying a kind word to the right person in St. Paul, and we can roll that back and hold the line on that, because again, that nocturnal messing with people's rhythms is just, you've already got a stressful enough job. Thank you for your presentation this morning. And for letting us be part of this discussion and presentation. Thank you. Leslie, is there anything else that we have on the agenda? We're at the end of the agenda. Members, anything else for the good of the cause? I'll entertain a motion to adjourn. Second. And all in favor say aye.
Aye.
And we are adjourned.
Good job, guys.
Well done.